town of Westfield is located in Union County in the state of New Jersey in the USA. It is an attractive commuter town of some 30,000 people and is conveniently situated for access to the cities of Newark and New York. In these leafy surroundings, a clinic offering alternative therapies for people with eye problems has developed a worldwide reputation. A map on the wall, appropriately marked with pins, shows from whence patients come to benefit from the expertise of Dr. Andy Rosenfarb.
Well, I grew up in Westfield. I knew the area well, and at the time we opened our clinic, Acupuncture Health Associates, 12 years ago. There was no acupuncturist in town, and it seemed like a great place. You know, Westfield's a beautiful town, and it seemed like this was a really great place to introduce Chinese medicine and acupuncture. Because the uniqueness of the specialization that we do, and there's so few practitioners who can successfully treat eye conditions, we see a lot of patients from all over the world, and we get really, really good results. I'd say about 80% of patients who come to visit our clinic do really well. People tell other people it's more than if we were to do a commercial and say how great we are. If patients get good results, they're going to come back, and they do come back.
Westfield is well served by public transport and is about 25 minutes by car from Manhattan. I'm Edward, and I live in the UK. This is my 4th visit to the clinic. I suffer from macular degeneration, and I find the treatment beneficial. Dr. Rosenfarb started studying conventional medicine, but a family experience caused him to change direction.
I decided to study pre-med in undergraduate, and that was my course. I was pre-med, dual major in biology and chemistry, and that was my track. My senior year, I was exposed to acupuncture and Chinese medicine. My father actually had gone for acupuncture to lower blood pressure, and he got great results. In about 6 months, he was off all medications. His health had improved, he lost weight. So after talking to this acupuncturist and learning a little bit more about Chinese medicine and acupuncture, it was a pretty fast career path switch.
Before beginning the treatment, a vision field test is taken to assess the functional state of the retina. While the patient stares at a cross in the middle of the screen, dots of light are flashed up, and you press a button if you see it. There are beeps sounding which may or may not coincide with the spots, so if you press just on sound alone, the computer will know you're cheating. A printout shows where the eye is damaged and or dysfunctional. This is Brad. Brad is being treated for retinitis pigmentosa. The needles used in the treatment are made from stainless steel. They are very fine and are barely noticeable as they are inserted. With the needles in place, the patient rests on the couch for 30 minutes. For very serious cases, strong needling methods may be used in order to activate the visual cortex of the brain and to stimulate both the retina and optic nerve. Andy specializes in a sub-technique of acupuncture called microacupuncture.
Microacupuncture is different than traditional acupuncture. Traditional acupuncture uses body points. Microacupuncture just uses points on the hands and feet. It was developed in Denmark in the 80s by a gentleman named Freddie Dahlgren and his associate Per Ada. Originally, microacupuncture was designed to treat arthritic conditions, and it did that pretty well. However, they found that the patients were reporting that their vision was improving. So as a result of this, they started getting eye charts and testing patients' vision. And lo and behold, they found that patients were actually, their vision was improving as a result of these microacupuncture treatments. Still tapping?
Yeah, but the right is a little strong.
A little strong?
Yeah, the top.
Over the years, we've tried different clinical modalities, and we figured that we keep those that work, those that don't work, we discard. We were trying magnets for a while, didn't really find them to be that beneficial.
I think I like the magnets better than the needles.
Can't imagine why. We tried ozone therapy, didn't find that to be very beneficial. Can help with retinal bleeding in some other conditions, but for macular degeneration, glaucoma, it didn't really show to be that effective, so we discarded that. There's really a long-term refining process of getting data in different clinical modalities, supplements, acupuncture techniques, and basically just using that which works.
This is a light needle. It obviates the need to place needles at points around the eye which some patients don't like, and can occasionally produce a black eye effect. Light needle is a way to use light in place of an acupuncture needle to stimulate the acupuncture points around the eye. This is especially great for children. Here Brad is being wired up for electro acupuncture. This provides a stronger stimulation to the acupuncture points and is used widely in China for treating degenerative eye conditions like retinitis pigmentosa, macular degeneration, optic atrophy and lazy eye. Specific electrical frequencies are used for each eye condition. The infrared lamp creates heat which is conducted via the needles into the acupuncture points. Certain points, when heated, improve results for specific eye conditions. All these eye conditions seem to have some common causes.
We have found some common factors in certain conditions. In Chinese medicine, they pretty much always say that glaucoma, for example, is always a result of liver condition. Sometimes kidney, but mostly it's a liver imbalance. Through modern medical research, we now understand that that's the problem. This goes back to what I always say about eye diseases, is all eye diseases are systemic diseases. They're showing up in your eyes, but there are systemic issues that are causing these eye problems that we need to evaluate and understand. I believe that's the big difference between Western medicine and Chinese medicine, and why conventional medicine is having such a hard time with these type of conditions. They're not looking at the whole body until they understand that there's a large brain involvement, there's kidney involvement, liver involvement, circulatory involvement, autoimmune involvement. You need to get the bigger picture to understand that that's what's going on with the body. We need to look at that very deeply.
Diet plays its part in the development of eye diseases, and Andy has some recommendations on this front.
Diet's a very important factor for all conditions, especially eyes. There's this thing that with macular degeneration, often patients accumulate something called drusen, which is kind of like gallstones or cholesterol that builds up in the eyes. Dietarily, you can address that by reducing things like cheese, reducing dairy, reducing red meat, anything that's going to be increase the amount of cholesterol and triglycerides and fat in the blood. So by taking things out like ice cream, milk, dairy, cheese, red meat, eggs, all these things that can potentially increase the cholesterol, you're going to help out a little bit. The other thing that's really important that we found is to isolate and identify specific food allergies. Food allergies can have, again, a cascade response that increases the cell death, the nerve cell death around the eyes and the brain and the rest of the body. So these pro-inflammatory effects of food allergies can be systemic and have really, really harsh effects on the body, and really can contribute to progressive vision loss.
No small electrical stimulus, is it?
Yeah.
Right.
Treatment is a continuous flow of learning and refinement.
I believe that research is really, really important. A lot of conventional medicine and a lot of the public just they don't understand that acupuncture can be beneficial for eye diseases. We're really doing groundbreaking work. We're trying to implement Chinese medicine with naturopathic medicine, acupuncture. And not everybody's going to respond, but some will. And it's certainly a viable option, especially because a lot of these conditions are, they don't have any cure. There's nothing that conventional medicine can offer. We know acupuncture works. At this point, we're really interested in figuring out which points are going to be most effective for which conditions. As a result of that, we've actually had interest from a lot of the major medical universities, one being Johns Hopkins down in Maryland, which we're planning this fall of 2011 to go down there and do a research project on the acupuncture and the treatment of retinitis pigmentosa. So the future is to really look more towards integrating what we do with conventional medicine to try to offer the best of both worlds for our patients.
Over a 2-week period of treatment, the vision field test can show a big improvement in the functionality of the eyes. Regular treatment does allow many patients to retain vision which would otherwise have deteriorated.
We're doing okay?
Yep.